evening. My name is Carman Covington, and I will be talking about EHRs today. So originally I was in a group, but so it just wasn't communicated. We weren't communicating effectively. So I drifted off because I came in late and I did not feel like it was fair for me to just join in on everybody else's work that they already been working on. So I did my own. So we'll go ahead and get started. All right, EHR. EHRs are electronic health records, and they have the ability to exchange health information electronically and more quickly and more effectively. So I'm going to play a short video which explains what EHRs are.
So what exactly is worth knowing? Think about how many times you've used the healthcare system, how many times you've visited your family doctor or a hospital ER, or had an X-ray or filled a prescription. Have you ever wondered how all that information is maintained and shared between these points of care? Or if it's even shared at all? Now think about how this could affect the healthcare you receive. Look at it this way. You visit a local walk-in clinic where the physician requests a number of tests. Unfortunately, those test results may not always be shared with your family doctor. A month later, you experience similar complications, and your family doctor performs the exact same tests. Wouldn't it have been easier and more efficient if your doctor could have accessed those original results first? In your community, when you visit any point of care, information is collected regarding your health. However, because these systems don't connect, information cannot be easily shared between healthcare providers. So when a doctor is treating you, there may be pieces of your health information out there that they don't know about. Now consider how important communication is in an urgent situation. Say, for example, you find yourself in an ER and you're unable to properly relay your medical history. Not knowing for certain if you're on any medications or if you have any allergies could hinder the doctor's assessment and even cause problems during treatment. Retrieving your health info instantly could have saved time and reduced the possibility of complications. In order to improve healthcare in Canada, we're working to...
Okay, so I like this video a lot, especially because they hit on points such as, like, say you come into the emergency room with an obvious emergency and you're not able to communicate with the first responders about your previous health, like any medications you're on, stuff like that. Because I watch a lot of Grey's Anatomy, so I kind of compared this whole unit to Grey's Anatomy, what I saw on there, like when they weren't able to get the patient's information, they were able to pull up all their records online just by using their name. And of course they needed more information, but by using their name and stuff like that, they were able to compare, get all the information that they needed, even though the patient was not able to tell them. Because if you do not communicate allergies, stuff like that, they could give you medication because they don't know, and that could make your health decline.
So what exactly is worth knowing?
So again, benefits of the EHRs are they better health by improving all aspects of patient care, including safety, effectiveness, patient-centeredness, communication, education, etc. Improve efficiencies and lower healthcare costs are promoted preventative medicine and improve coordination of health services, as well as reducing waste and redundant tests. So paper. That used to be how a lot of your health records were stored, and it wasted a lot of paper, and it was costly, and it's hard to get that information transferred from one place to the next. So the new way that we've been doing it is way more effective. It's a lot of places use iPads or like the little Chromebook tablets and stuff, and they can, like, right there, they check you in, do everything on that tablet or iPad. Drawbacks of EHRs. EHRs may cause several unintended consequences, such as increased medical errors, negative emotions, changes in power structure, and overdependence on technology. So technology is never really dependent. It's there for the most part, but you just never know. So there could be a power outage, stuff like that. And the backup, maybe I watched a lot of Grey's Anatomy again, and there was a time where the hospital power went out, which caused all the iPads to go out because they were dying. And they were not able to look at electronic records to make sure because they had to rush and go and find paper information on one of their patients because they were about to administer something that could kill that patient. It was a little boy, and it was something he was allergic. I can't remember the exact episode, but he was allergic to something, and they were like up in the air about it because he was really sick and he was in pain. And there was 2 medicines that he could receive, but only out of the 2, one of them would make matters worse, and the other one would help. So they had to kind of play with it a little bit until they figured out which one it was, but before it was too late. So these 4 are more drawbacks of using EHRs. So a clinician work process may make it harder or impossible to appropriately enter the desired EHR data. Alerting, you never know who's out there lurking, able to hack systems. So people can hack into hospitals and get important information of the patients and stuff like that. Visual display, clinicians may find it hard to interpret information because of EHR displays are confusing, cluttered, or inaccurate. So just doing that, these things are constantly refreshing, and you could accidentally start tapping on one person's name and put the wrong information on the wrong patient, because when you saw it 2 seconds ago, it was the right person, but it just refreshed. Now it's on a different person. These are 3 of the different systems. The first 2, Outscripts and MK Solutions, they are the most popular in like hospitals and stuff like that. And then you have your Angel systems, and they provide they provide a system for inpatient, residential, partial substance abuse, outpatient, community services, organizational needs, and special education. So going back to flaws, this is like a quick little video. It's going to hit on one of the points I made earlier about it constantly refreshing and stuff like that.
Remember when going to the doctor's office looked like this? Now it looks more like this. Across the country, more and more doctor's offices are using electronic health records, or EHRs. As digital records have become more common, unanticipated problems with design, workflow, training, and how clinicians use them have contributed to patient harm. To learn more, we talked to MedStar Health's Dr. Raj Watwani, a leading researcher on EHR usability and safety.
EHR should make it easier and safer for clinicians to provide care to patients. The suboptimal usability of EHRs can lead to mistakes like selecting the wrong patient, ordering the wrong drug, and missing critical lab results.
MedStar Health's Dr. Terry Fairbanks, who studies human factors in healthcare, explained how a computer auto-refresh error can cause a problem without the doctor even realizing it.
Let's take 2 patients, Martha Jones and Daniel Rodriguez, who come into the emergency department on the same day and have similar issues, so they both need a chest x-ray. When the doctor goes to see Martha Jones, they pull up the patient's electronic health record to look at the x-ray. And the doctor actually pulls up Daniel Rodriguez's x-ray, thinking that it is Martha's. And this x-ray appears normal, so the doctor sends Martha home. This all happened in a fraction of a second. So let's slow it down to see what actually happened. In between the first and second click, the database updates with new patient information and auto refreshes. So by the time the doctor finishes the second click, the x-ray icon his cursor was on now belongs to Daniel Rodriguez. Daniel's x-ray looks fine. On the other hand, this is Martha Jones' actual x-ray. You can see there's a large white area here, which represents a pneumonia, which needs antibiotics. Without antibiotics, Martha could get much worse very quickly. This is one example of a health IT facilitated error, and there are many others.
This is a fixable problem, but currently there's not enough research on how and why these errors occur.
All patients deserve the best care possible. We need better data now on how, when, and why these challenges arise so that we can all do a better job protecting our patients.
Remember when going to the doctor's office looked like this?
Okay. And then this video is going to demonstrate how easy it is to upload and share information across areas.
Your electronic health record is one of the most valuable sources of information you can share with all of us. So let's talk about what it is and why it's important. Your electronic health record, or EHR, is a record of the care you've received from your doctor and medical facilities. It's created and updated by your healthcare provider and includes things like health issues, medications, and treatments. If you see many healthcare providers, you may have many EHRs. Because it compiles the history of your medical care, your EHR can show a more complete picture of your past and present health than other sources of information. And this is why it's an important part of the All of Us research program. When it's linked to other health information you provide through the All of Us research program, it can help researchers spot patterns in what makes us sick or healthy, and why. These patterns can reveal important new medical insights that could lead to better preventive care and treatments for future generations. With great data comes great responsibility. The All of Us research program has a team of experts who work to ensure the security of your data.
Okay, so I also like this video because they hit on how easy it is to upload and share information. So if you were to, and how important it is, like your electronic health records are very important and it should be easily accessed. So I like EHRs now because I can access anything that I need on my phone. Like I have the app. So if I go to the doctor or something like that and I get tested for something, it's all of the information I need is on the app. I can easily pull it up, even if I go to a new doctor, if they can, they're supposed to be able to pull it up, but I also have it on my phone so I can tell them exactly what was going on when I experienced whatever. Even with, it's kind of different, like with dogs, like I have 2 dogs and their electronic health, like their records, when I take them to get groomed or to the borders, like I have to have their proof of vaccinations, their rabies and all that extra stuff. So it's good that I'm able to pull it up on my phone so I can get it to them. Well, now that I'm with I go to Banfield now for them and I can pull it up on my phone easily. But I went to like another vet. It was hard. Like I had to call, get the information faxed over and all that. It was just a hassle, because especially on weekends trying to do all that because a lot of places are closed. But yes, so just having access to your records is really important. And now with the electronic health records, it's easily accessible to not only the doctors, but the patients as well.
Your electronic health record is...
Okay, and then EHRs help providers. In conclusion, EHRs help providers manage care for patients by providing accurate, up-to-date, and complete information about patients at a point of care, safer, more reliable prescribing, because when you're going to a pharmacy, you can refill your prescription at any pharmacy, but now that everything is online, you can transfer information to wherever you need to go so that they know what medication you need and stuff like that. And also it helps so that you cannot go, like say, I know that opioids and stuff was a whole thing. So, some people were buying them and abusing them. So it's like, if you were at one pharmacy, you got a prescription, you can't go to the next one and try to get it prescribed, get it refilled the next day. It's all in the system. That way, it helps providers more effectively diagnose patients, reduce medical errors, and provide safer care. So EHRs are very reliable. You just have to pay very close attention. Like in the video that I showed earlier, the man had accidentally, he was probably looking up talking to the patient, and when he was clicking on it, the thing refreshed and he clicked on the wrong person's name. And if he would have looked at the wrong person's x-rays, he would have sent the person who actually needed care home and kept the other person in, and it could just cause a lot of errors if you're not very careful and paying attention. It's the same thing with paper and pens. You have to be very responsible and make sure you're paying attention at all times. But in the end, EHRs are more reliable and easier to access than the paper method. So I give EHRs a 4 out of 5 if I were to rate them. And this is my works cited. And yes, so that's my presentation on EHRs. And once again, in conclusions, they are very effective. It's great for not only the physician or caregiver, it's also good for the patient, because as a patient, you should always have access to your health records and stuff like that. So, yep. Thank you for watching. Have a good one.